The health practitioner watchdog has put medicinal cannabis prescribers on notice, saying poor prescribing practices and surging consumer demand are leading to significant patient harm. National Health reporter Elise Worthington has the details.
AHPRA's today issued a whole list of concerning cases that it says it's seen within the medicinal cannabis space. Broadly, they're interested in these sort of one-stop shop telehealth medicinal cannabis business models where you can have a brief consultation sometimes with a doctor and be prescribed a medicinal cannabis product that company will then sell to you and ship to you. So today they've released a list of concerning incidents, including people under the age of 18 being prescribed medicinal cannabis products, consultations with doctors ranging from a few seconds to a few minutes in length, and other sort of, issues around not proper due diligence being done in consultations with patients. So they're worried that this product is really being prescribed too quickly to some patients where it may not be the best treatment for them, and there isn't a continuity of care or follow-up with that patient's regular medical practitioners.
What action has it taken so far?
Well, today it's revealed that there have been 57 medical practitioners, nurse practitioners and pharmacists who have been cautioned over their medicinal cannabis practices, and that it's investigating a further 60 practitioners over this issue. Really, the message that it's putting out is if you are prescribing, you need to be very careful about the way that you're doing it. Some of the figures we've seen around the number of scripts a very small number of practitioners are writing are extraordinary. We're seeing more than half a dozen who have written over 10,000 scripts in a 6-month period, and one who had issued 17,000 scripts. So that equates to about one every 4 minutes in a working day. So really the regulator is saying we'll be looking very closely at some of these practitioners who are writing large numbers of scripts while the majority are doing the right thing. They don't need a complaint to be investigating these unusual patterns of prescribing, and we'll be looking a lot more closely at the way that these consultations are being undertaken and the due diligence that's being done.
What do we know about the new guidelines introduced?
Well, these guidelines include things that are really basic that you would expect doctors to already be doing, like having lengthy consultations, taking an appropriate medical history, ensuring that contraindications or patients' other medications that they're taking are being checked properly first, and that you're communicating with that patient's regular medical practitioner. But it also specifies that patients need to be informed that medicinal cannabis is not a first-line treatment and shouldn't be used as such, and also that it's an unapproved medication for the majority of conditions. That's excluding things like childhood epilepsy, multiple sclerosis, and some forms of chemotherapy-related nausea and pain. But for most conditions which we can see through the TGA data that it's being prescribed for, things like anxiety, insomnia and chronic pain, it isn't a first-line treatment, and patients really need to be properly informed about their other options for treatment before they're prescribed a product like this.